So I've developed a little bit of an overuse injury in my hip from the high frequency of squatting in this powerlifting program that I'm running. So I wanted to talk about how I'm going to manage it and rehab it as I continue to train. So I had to pinpoint where the pain was coming from. So I cleared out the lumbar spine and the hip joint itself, and then came to the conclusion that the injury was mostly muscular. So I had to pinpoint what musculature this injury was coming from. And this ended up being the more anterior lateral portion of the hip musculature, which is made up of your TFL and the anterior fibers of the glute med. So your TFL is your main abductor, so kicking the leg out to the side. It's also assisting hip flexion, so it works more in hip flexion. So it's really one of the muscles that works the most in the hip when you're in a squat going into hip flexion. And this doesn't mean I'm going to stop training or stop squatting. I'm going to use variations that are more comfortable. But in the meantime, I'm going to try to facilitate some of the back of the hip musculature, like the posterior fibers of the glute med and the glute max. So in the exercise you've been seeing me do here is an isometric for the glute med. So I'm pressing out into abduction as I come into hip extension with the glute max. But I'm also facilitating good oblique engagement. So I'm firing the obliques to stabilize the pelvis as I do so, to allow the glutes to do what they want to do. But this is really just to modify symptoms and to make me feel better as I go into some of the more strenuous exercises following it. And then this next one is a side plank variation where I'm really emphasizing just to fire the posterior fibers of the glute med and to not get the TFL engaged. So I'm abducting and slightly externally rotating that top leg in a more hip extended position so that the TFL can't work. And I'm trying to facilitate, again, that glute med. That bottom leg is also getting a nice isometric while it holds there in that side plank position. So again, engaging obliques and glute med together to try and work on that pelvic stability, which is probably where I ran into the issues in the first place. And this variation actually is a lot harder than it looks with the straight leg. And if you're not using your trunk to compensate, if you just let the hip do the work. And then the final variation here is the most specific to squatting because I'm in closed chain with the standing leg there, but the cable is pulling me into more of a stretch, but it's the same movement as the side plank. Make sure to like, share, and follow for more rehab tips.